Today's medical-centric topic is circumcision and UTIs, myth versus evidence in adult men. Why this topic creates confusion. Circumcision is often discussed as a preventative measure for infections, but its role in preventing urinary tract infections in adult men is frequently misunderstood. Many assume circumcision eliminates UTI risk, while others believe it has no medical relevance at all. The reality is more nuanced and depends on the underlying cause of infection. How common are UTIs in adult men? Urinary tract infections are relatively uncommon in adult men compared to women. When they do occur, they are usually considered complicated UTIs, often linked to prostate enlargement, urinary obstruction, catheter use, diabetes, kidney stones, or poor bladder emptying, rather than external contamination. The myth: circumcision prevents UTIs in adult men. Circumcision does not reliably prevent UTIs in adult men. While removing the foreskin reduces bacterial colonization on the penile surface, most adult UTIs originate from bacteria growing inside the urinary tract due to urinary stasis or obstruction. Circumcision alone does not address these internal risk factors. What the evidence actually shows. Strong evidence supports circumcision reducing UTI risks in infants, particularly during the first year of life. However, studies in adult men show only a minimal protective effect. Any reduction in UTI risk is small and clinically insignificant for most adult men. Role of the foreskin in infection risk. The foreskin can trap moisture and bacteria, especially in men with poor hygiene, diabetes, or phimosis. This increases the risk of local infections such as balanitis. These conditions may cause urinary discomfort or inflammation, but are not the same as true urinary tract infections. When circumcision may help adults, such as men with recurrent balanitis, chronic foreskin infections, or severe phimosis. In these situations, circumcision improves local hygiene and reduces inflammation, which may indirectly reduce urinary symptoms but does not directly prevent UTIs. Common causes of UTIs in adult men. Most UTIs in adult men are driven by prostate enlargement, incomplete bladder emptying, urinary stones, strictures, catheterization, diabetes, or immunosuppression. Addressing these factors is far more effective than surgical foreskin removal. UTIs versus foreskin-related symptoms. Penile irritation, discharge, or burning from foreskin inflammation is often mistaken for a UTI. True UTIs typically cause dysuria, frequency, urgency, fever, or systemic symptoms and require urine testing for confirmation. What clinical guidelines recommend? Routine circumcision is not recommended as a preventive strategy for UTIs in adult men. Clinical evaluation should focus on identifying underlying urological or metabolic causes rather than circumcision status.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.